Welcome to the Susan Brender Show. It's all about you. Featuring shows on health and wellness, the performing arts, politics, and people who inspire you to be your very best. And now, here's Susan Brender.
I'm Susan Brender, and this is the Susan Brender Show. Today, my guest, Carman Gill, is a professor from Florida Atlantic University. Now, she received a PhD in counselor education from the University of North Carolina at Greensboro, and she holds an Approved Clinical Supervisor credential and a National Counseling credential. Now, Dr. Gill's extensive counseling experience includes UNC-G University Clinic Counselor. Now, I'm going to talk all about all of her very impressive credentials, but first I want to say to Carman Gill, I want to welcome to you, Carman, to the Susan Brender Show.
Hi, Susan. Thank you for your very warm welcome.
Now, Carman, okay, there's a lot of different people who deal with mental health issues. You know, you have psychiatrists, you have psychologists, you have so many different people who social workers, I didn't mention that. Now, how did you get involved in mental health, and what exactly is a counselor?
It's a great question. I originally got involved in mental health in my early 20s. I was a school teacher for a very long time, and I noticed that certain students were struggling with emotional and behavioral symptoms that were really harming their progress through the educational system. I got involved first in that setting, and then eventually with severe and persistent mental illness through the state institutions and adults who had substance use or severe issues with mental health. My original experience in doing mental health and working in the mental health field was as a tech. Mm-hmm. So at that point, I had a bachelor's degree. What I noticed was that within the field, there are several different disciplines. And I think most people notice that, and that's what they think of. When they think of mental health, they think of the various disciplines like psychology and social work. And they are very different fields, even though it doesn't seem like it from the outside. For instance, counselors tend to focus on the relationship. Counseling is defined as a professional relationship. Mm-hmm. This relationship, the goals are to help the person become more well or maintain their wellness. It's very outcomes-based in nature. And it's a very empowerment-based discipline. Whereas with psychology wants to get at the etiology of what's going on, what's happening with the person, where did it come from, how do we diagnose it, and they tend to do a lot of testing. Mm-hmm. So you see a lot of personality testing, testing for things like ADHD, for severe and persistent mental illness symptoms. So that discipline tends to focus. They do some outcome-based things as well. They do some therapy, but they tend to really focus on those issues. Mm-hmm. For social workers tend to do the linking of services. So, for instance, the social worker's client might need help with Medicare, Medicaid, help accessing doctors, help linking their treatment plans. So social workers, whereas they do some therapy as well, they tend to focus more on the linking of service. Mm-hmm. So counseling really focuses on that professional relationship.
Right.
Does that make sense?
It makes a lot of sense. Now, just a minute. You know, when you talk all about all these different disciplines, I can't help but think about what's going on today. You know, we have so many people who are homeless. We have lots of people coming home from the war with diseases like PTSD, and because of the computer, and this is really where I'm geared to. I want to know whether the life that has changed so much in this country and all over the world has an impact on their needing different people like, as you said, psychiatrists and psychologists and counselors. Has things gone different than the way it used to be? Is it better? Is it worse? Tell our audience all about that.
Well, I do think that we're seeing modern-day trends in the field of counseling and in these different disciplines as well. You mentioned, for instance, folks returning from war. You mentioned PTSD, and you also mentioned homelessness. Interestingly enough, there are very high rates of mental illness among homeless men. And there are very high rates of post-traumatic stress disorder that we're seeing in vets that impact their income and their ability to maintain housing or maintain a normal life just in general. Years ago, war meant fatality. The human casualties were really high. Now we have the ability to fight wars very differently. People come back with physical injuries that we're able to fix, and they don't die at high rates, which is wonderful. Mm-hmm. But they do see things and go through things that changes the way they experience the world. So we are in our field seeing a real uptick, I would say, in dealing with those symptoms and trying to understand how to help those folks who are struggling with post-traumatic stress disorder as a result of war or any other kind of traumatic stress.
Yeah. Carman, there are so many people that we mentioned that go to hospitals like veterans hospitals and places of that nature. And I've been told when I've interviewed, and I just did an interview with a woman who said veterans hospitals don't give the attention that the military deserve. Now, do you know anything about that? And if you do, tell our audience about it.
Well, I think there continues to be a stigma in the military regarding mental health and mental illness, especially things like post-traumatic stress disorder. We just heard a few days ago Donald Trump mention that it's a weakness. The weaker people struggle with this, and that's not an unusual attitude. In the military especially, folks are seen as, they're not promotable. Perhaps they're not really military material if they're expressing those kind of symptoms. So I think that the issues with the VA begin well before people get to the hospital. So if you consider something in a negative light, you are less likely to support it financially, emotionally, whatever these VA hospitals need. So it's really difficult on the front end for them to get the support they need. And yes, when people get to the hospitals, they're usually in a pretty bad state because they've put off getting care. They don't want to be seen as weaker. They don't want to be seen as having a problem. So they wait a long time. They're usually very ill, and it's hard to get the care that they need, the level of care that they would otherwise get, I think, outside of that system.
Now, is it different from men than it is for women? Do more men are they diagnosed with PTSD as opposed to women?
There are not many differences in the rates of PTSD diagnosis. They tend to be pretty similar for both genders. It's much harder, I think, for men to want to say that they are experiencing these symptoms, so they tend to downplay or not acknowledge what's going on with them, whereas women are more likely, I would say with the exception of the military, because the military can be very hard on women who acknowledge these symptoms. So in general, women are more likely to say, yes, I'm having trouble and I need help.
Mm-hmm. Yeah. Now, also, with regard to substance use, first of all, I want you to tell our audience, when you refer to substance abuse, are you talking about drugs? Are you talking about alcohol? What exactly is a substance?
Sure. A substance is anything that you use that can chemically alter your body. You can consider nicotine a substance. The DSM-5 lists nicotine. It lists caffeine. I'm sure I probably qualify for a caffeine use disorder at this point with my coffee. So anything when you're talking about diagnostic manuals such as the DSM-5, it can be quite a range of things. So you are talking about drugs, alcohol. Yeah. Yeah,
and has there been an increase in the substance abuse since World War II, for example?
Well, just in the last 3 to 5 years, there's been an alarming increase in the amount of opioid use in this country. I think we're seeing statistics, especially among white males in their early to mid-20s, higher rates of folks dying from opioid addiction, from opioid overdose. There's, very sad. But it's definitely, and you can even, if you look at the media, actors and actresses, even, Prince, a lot of these artists are now, they're suffering and they're dying from opioid addiction, which has become a real problem for us.
Now, what do you attribute it
especially
to?
for Palm Beach.
Yeah, and what do you attribute that to, Carmen? Because, you're talking about somebody like Prince, and there are so many stars that you hear are heroin addicts, alcoholics. There must be a reason, because look at their life. I mean, if you were in their shoes, and you had this amazing house, and you had an incredible life where people looked up to you, and you were just a fabulous, from my standpoint, it sounds so fabulous what they do. Now, why? What do you attribute to the fact that they're doing all this?
There are likely individual reasons for each person, but in general, I would say it's a negative coping mechanism. Folks like Prince and Michael Jackson and some of these other stars originally got these pills, these substances because they were in some kind of physical pain, and then they overuse and abuse, and they don't have the coping skills or the ability to just stop. It's not as easy also as it sounds. For some people, it's a very hard thing to quit those kind of substances once they've stopped. So negative coping is probably the biggest culprit. We know that medical doctors have been prescribing a lot of pain medication in the last few years, and some would even say over-prescribing. There seems to be a push by the drug companies to continue this behavior. And what happens when somebody is addicted to an opioid? You want to think of something like Oxycontin or, hydrocodone, those kind of things. And then they can't get them from the doctors anymore. Heroin is not that different. It's the same class of medication, so they can get it on the street.
Yeah. Now, you talked about doctors. This, to me, is a very important topic. Now, the reason is that are doctors trained? I mean, I'm talking about any kind of doctor. You're your number one practitioner that you go to, or, heart doctors or any doctor. You say that they're the ones who administer or give the drugs. Now, have they been trained, and do they understand how those drugs are going to react to the people whom they see?
I would assume so, but I couldn't make that statement for sure. Again, I would assume that they would know the type of drug that they're allowed to prescribe.
Okay. So you think the training in medical school is good enough?
I'm not sure about the term good enough. I would love to see there be some supplementary training about long-term impact of addictive drugs. I know lately there's been more of a crackdown on, not prescribing these as frequently. There can always be more, I think, education.
Yeah. Now, if you had a chance, for example, to go into a medical school and teach the students various things, what would you want to teach them that applies to what you do?
Basic ideas around mental health and how they might see mental illness playing out in their practice. One of the things that we as counselors do when we're seeing a client for the first time is we send them to the medical doctor, because we know that depression can be a part of things like thyroid disease, or just a woman's natural life cycle in menopause can sometimes display as depressive symptoms. So we want to rule out any kind of medical reason that there might be, get them treated for any medical reason that might be causing the symptoms. So the opposite, I believe, should be true, that medical doctors, when they're screening, when they're talking to the patients, should also be looking for the same things. What are the symptoms that I'm seeing emotionally and behaviorally? What is this person sitting in front of me saying that they're not saying? So they're having trouble with shaking. They're having trouble with sweats and the flu. Might there be an addiction problem? Those kind of things.
Right. Okay, now, Dr. Gill, and I didn't call you doctor, and I think it's important that the people know that you have received a PhD in counselor education, as I said in my opening. Now, Dr. Gill, tell me something. You've written a couple of books, or I assume they're books. why did you write those books, and what's in them that can help people to learn a lot about what you are practicing in counseling?
Sure. I have one published book at this point, and I'm working on a second. The first book is based on the changes from the Diagnostic and Statistical Manual for Mental Disorders, from the DSM-4 to the DSM-5. So there were significant changes to the way we do diagnosis and treatment between those two manuals, and counselors needed to understand those differences, first of all, for billing purposes so that they can get paid, but also to properly treat the client and understand them in a spectrum of symptomology, which is what the DSM-5 does. So that book was focused pretty much towards clinicians and counseling students, just to help them out with those significant changes. So the book that I'm currently working on is based on spirituality and religion and counseling, which is a passion of mine. For so long we had the idea that we don't talk about sex, politics, or religion. And that carried over into the counseling setting as well. It's just things you don't do. The shift in the last 15 to 20 years in the counseling field has emphasized the role that religion and spirituality play in people's lives. 96% of this country endorses a belief in the divine. Many, many people claim to be Christians and regularly attend religious services. So we need to be mindful of the clients in our office and how religion may inform the problems that they're having, may be positive or negative coping in their lives, how spirituality might play a huge part of who they are and how their symptoms manifest or how they cope with their symptoms. The example that I like to give is when working with a suicidal client. Oftentimes when you ask for a contraindicator, what stops you from harming yourself, from carrying out your plan? They will reply with a religious answer. This is not something that wouldn't make God happy, or, it's not something that my religion endorses. I wouldn't do that. So these are things that can be really tapped into as strengths and coping to build on for people.
Now, I'm glad you brought up the word spirituality, because that seems to be a very vague word. Sometimes when people use that word spirituality, it kind of sounds, and forgive me, I'm just going to use a kind of weird thing. It sounds weird, and it sounds woo-woo. Spirituality? What's that from your perspective?
Sure. Well, I think there's a reason that it sounds a little weird and woo-woo, because it's so individualized for people. What I might call spirituality might be very different from what someone else does. Basically, we look at spirituality in terms of 4 components. We look at it as the idea of meaning and purpose in life, what we tap into for our meaning and purpose in life, in terms of interconnections with ourselves, with the earth, with others. We look at it in terms of belief in the divine. Can you be spiritual and be an atheist? I believe so. I believe everyone has a spiritual component. So it's something that needs to be acknowledged as very individual, but having some themes. Spirituality is the thing that allows people to transcend the problems in life, the things that would normally cause severe reactions, and they're able to put those traumas or events into a spiritual context and really just get beyond what's happened to them or what they're going through.
Now, give me an example, if you would, of a person whom you've worked with in your practice. I mean, I don't want any names. Nobody's interested in who specifically that person was, but I would love to go through the process with you. So a person comes into your office and they say that they're severely depressed. I mean, they know what they feel. They're in a dark hole, and they express that to you, and then they say, I need so much help, doc. Please help me. So take us through the process of what a counseling session looks like.
Sure. Yeah, there are many different theories of how you do counseling with people. I will talk to you from an Illyrian perspective. There's also a cognitive behavioral, which is a very evidence-based. There are a lot of studies for the efficacy and efficaciousness of that therapy as well. There's wellness theories and models that people work from. I find Illyrian to be very general and specific at the same time. I don't know if that makes sense. Mm-hmm. But there are basically 4 steps in the process for an Adlerian counselor. And the first one would be to build the relationship. So to try and understand, put yourself in that person's shoes, try and understand their viewpoint, because everyone's viewpoint is very different. It's almost a social constructivist way of understanding what's going on with this person in this person's system. And so while you're doing that, you're actually working on step number 2 as well, which is assessment. So I need to get all the information I can to find out what's going on with this person. Mm-hmm. And for Adlerians, a lot of that has to do with childhood experiences, because that's where they believe patterns begin in our lives. So I want to assess the individual. I want to kind of understand what the major influences were as a child and what they are now. The next step, as an Illyrian, once I've done the assessment, once I've, kind of come up with a theory, mm-hmm. a hypothesis about what might be going on, I'm going to talk to that person about it. I'm going to talk to that person about some ways we can deal with it, we can work with it. When you get to know somebody and you see that the issues they're having, the private logic that's not working, and you put it out there in a very kind way, ask them, this is what I think is going on. Oftentimes, that's intervention enough. Mm-hmm. When a person looks at, this system, this pattern, and how it's not working, they want to change it. So that's where intervention begins, and we work through the intervention. And then reassess, again, the last step. We want to reassess. We want to see what's changed. We want to see how else we can help. Mm-hmm. So you wouldn't do all of those in one session, but in general, the sessions will follow those flows.
Yeah. All right. Now, here is another thing that I think is really important for people. So depression, for example, I was told that there are 25% of the women in this country will suffer from depression. Is that statistic accurate?
It actually sounds a little low to me.
Really?
It does. And I don't have my DSM in front of me, but the DSM-5 does talk about rates of depression by gender, and women tend to struggle with it more often than men at higher rates. Now,
has that changed? And what do you attribute that to?
Well, a lot of folks, it has changed. It's actually become more stable for women. A lot of people will attribute depression to, different causes. And for different people, there will be different causes. Biologically, we know that it tends to run in families. We also know that in this country, there are very high rates of abuse among girls, and that obviously contributes to depression. Mm-hmm. We also know that there's a systemic oppression of women. It's not as bad as it used to be. The feminist movement did a lot for this country. But just in general, women have to work harder for the same amount of money. Mm-hmm. Things cost more for women. Certain role expectations are much more difficult. Mm-hmm. And even body image stuff, when you think about what goes on with young girls and women, the pressures that are put on them in terms of their body. Mm-hmm. So there are a lot of external factors as well as some internal ones that impact those rates.
Yeah. Now, this is a pretty personal question that I'm sure our audience thinks about, and it has to do with the fact that when people are depressed and anxious, there's a lot of difficulty with their sex life. Now, have you ever talked to anybody, or do you teach, or do you practice how people can have a better sex life even though they're experiencing some mental problems?
I think that's a great question, because that's another big trend in our field. Human sexuality is now a course requirement in several states for master's level counselors to have in order to become licensed. And this is just now becoming a real trend in the field that we're seeing. I have not had that experience, but I certainly am interested in seeing where the literature and where the licensure bodies go with these requirements for our counselors.
Yeah. There was a TED Talk just recently, and they called it erotica. And they said that a lot of people, whether they're men or women, need to be able to understand that sex is a kind of very important thing when you are in a situation where you have depression and anxiety and various other mental diseases, because it shows love, and people need to touch. They need that tactile thing. They need to just see that somebody loves them, and so that's why I talk about sex in this conversation for counselors, because when somebody is in that black hole, it's very difficult for them to come out of it, and sex is like the least that they think about, but it can play a real great part in recovery. But I want to move on to one more thing, and that is the arts. I knew, and I'm going to tell you a story. I knew a woman who was suffering, and she was super depressed, and she one day she just started to paint, and after that she saw these paintings that she did, and it transformed her in ways she couldn't even describe. So my issue for you is to know, do you think that if somebody gets involved in the arts, I'm talking about they sing, they dance, they paint, do you think that's a good thing for them?
Absolutely. And in fact, there is an entire division of the American Counseling Association called Association for Creative Arts and Counseling that emphasizes just what you're talking about.
So do you ever talk to, or do you discuss with your patients, do you say to them, look, this is a tough time. I understand. Keep on coming to me, and, we'll work it out. But to distract your mind, do something that is productive and useful and fun. Do you say that to them?
Yes. And as I hear you talking, I think about the wellness models that we frequently use in counseling. And one component of the wellness models is leisure. And when we talk about leisure in that way, we're talking about an experience in which a person so loses themselves that time tends to stand still for them, and they're fully engrossed in what they're doing. And oftentimes that is an artistic event. So we encourage that. Do that outside of the session. Leisure should be engaged in at least daily, just like exercise. It's so healthy for the body. People struggling with depression will feel a lift right off if they just move more. So absolutely.
Go ahead.
Yeah, and you can even combine those. I mean, for folks who love to, art is a physical expression for them, such as dance, that sort of thing. Absolutely, it's a double bang for your buck, right, if you can get them to engage in that. Mm-hmm. Within the session, we like to get them engaged in creativity as well. You think about sand tray therapy or play therapy with children, or even art therapy. It's strongly encouraged. When we do spirituality therapy, we often use things like mandalas. We have them do genograms. We have them talk about, what those pictures mean for them personally.
Right. So we're almost at the end of our show, and I always like to say to my guests, I say, let's give the last word. Tell people what we haven't discussed already, and something that is really important. I want to finish your show on that. So, Carman, what would you say to our audience?
I would say just in general, the field of mental health is one of them that we are just now beginning to acknowledge. The impact of healthy mental health, just like healthy physical health, and holistic wellness cannot be understated. We need to be aware of what's going on with our bodies, just like we need to be aware of what's going on in our minds. Thinking about thinking, metacognitions. You can choose the life that you want by choosing how you respond, by choosing how you engage. Some of this can be done in wellness therapy wellness counseling. It can be done at home through meditation, just understanding how to be in touch with yourself, how to live your life more fully is so important. And reducing the stigma of mental illness and improved mental health will make our country a better place. We see the impacts of not treating people for their needs in this area. It's very negative.
Right.
So that would be my biggest message.
Mm-hmm. And when do you think that you're going to finish your next book, and what is it going to be called, and how can our guests get it?
Yeah, great question. So the next book is due to the publisher. It's due in November of 2017, and that's going to be published through Routledge. The name of the book is Spirituality and Religion in Counseling, Competency-based Strategies for Ethical Practice.
Well, today my guest has been Carman Gill. She's an associate professor for Florida Atlantic University, and she's received a PhD in counseling, and she has a lot to say and a lot to give to her patients. And if they want to get in touch with you, Carman, is there any way that they can?
Absolutely. My email is gillc@fau.edu.
That's great. Well, thank you so much, Carman Gill, for being on the Susan Brender Show. You gave our audience a lot of education and information about mental health, and I really appreciate it, and I'm sure they do too. So thank you again.
Thank you for listening to the Susan Brender Show. To be a guest, email sebrender@yahoo.com.